wonderful day. Hi, welcome back. Thank you for subscribing to my channel, and for those who did not subscribe yet, please subscribe na. And if this is your first time to attend, welcome to Dr. Krill's online class. And thank you for spending time with me dun sa mga nauna kong mga videos. And promise you will not regret it. Instead, you will learn from our discussion. And our topic is about menstrual cycle. It's common deviation from normal period. What else? Condition that affect the cycle. And of course, the Fertility Awareness-Based Method, madami-dami yan. And we will discuss on how to use it with those different methods. And sana you will learn from the discussion. May I clarify lang po ha, I am not providing a medical advice or any guidance in preventing pregnancy. This is merely a reference tool for our nursing students and for our registered nurses also and other health professionals, and of course just for their knowledge, okay? And if you have any clarifications, please let me know. I am open for any suggestions, and of course if you have some information to add, so please write it in the comment section. By the way, the contents of the discussion were taken from maternity nursing book, and I don't have the intention to claim it, and I don't own the rights, of course. But the graphic art was drawn by RC. Please follow his TikTok account at Your Bride Creates. Okay, I will put it in the description box of this clip. And photos are contributed by Airelle, Cyra, Jane, and to my colleagues, Ma'am V and Ma'am Alice. Thank you. So without further ado, kasi parang dami ko nang sinabi, let's start. Sit back, relax, and learn from the discussion. And of course, please, if you find it informative, do like, share, and subscribe to my channel for you to be updated for the coming discussion. So ayan, let's start na po. Anyone here in the class experiences any abnormality in the menstrual cycle, or anyone are in good? What I mean is normal one, okay? So here for the menstrual cycle, what do you mean by menstrual cycle, by the way? Menstrual cycle, lahat naman tayo nakakaranas nito, di ba? Kasi mga girls tayo, girls. So menstrual cycle begins with the first day of the period or menstruation and starts over again when the next period begins. So throughout the monthly menstrual cycle, the body makes different amount of chemicals called the hormones, di ba? Hormones. Ano-ano nga ba yung hormones na meron sa atin dito? It's the estrogen and the progesterone, okay? That is to prepare for pregnancy. That is why menstruation is also called monthly hormonal cycle, okay? So yan. And throughout the cycle, it can cause menstrual symptoms, okay? We will have it later. Menarche. So when we say menarche, this is the onset of the first menstrual period, okay? Normally occurs between the age 9 to 16. So anytime between 8 to 16, sabi natin kanina. Pero some authors sabi 15. Okay? The first period normally starts about 2 years. About 2 years after breast what do you call this? First start to develop and pubic hair begins to grow. Ayan, 2 years na medyo nade-develop na yung breast at meron nang nag-start na mag-grow yung pubic hair. So menstrual cycle in the first 2 years then of post-menarche tend to be irregular. Okay? Irregular menstrual cycle are associated with irregular ovulation then. Okay? But a girl should see a doctor if she starts the period before 8. Okay? Before 8 years old. And pwede ding pumunta sa doctor, sa OB-GYN, if she had not her first period by the age of 15 or 16. Okay, hindi pa siya dinadatnan, 15 na siya or 16 na siya. Okay? And if she has not had first her menarche, yun na lang yung term natin na gamitin, her menarche within 3 years of breast growth, ayan. Okay na yung na-develop na yung breast niya, tapos wala pa din siyang menstruation. Okay, 3 years nang nakakaraan. Kasi sabi nga dito, within 2 years, pwede nang magkaroon ng menstruation. Okay? And, syempre, pag may menarche, meron din tayo perimenopausal transition. That is what we call the menopause. Okay? So, malapit na ako dito. Malapit! Because when it's the menopause, it's the cessation of the menses. Okay? So, ayan. So, the period may also changes or may also change as an individual gets older. Ayan. Some women have malakas na yung bleeding during perimenopausal. There are symptoms din na yung malakas yung menstruation, like bleeding through 1 or more pads or tampons every 1 to 2 hours lang. Diba? 1 to 2 hours lang, nakakadami ka na ng pads or 1 to 2 pads. And passing out of blood clots. Okay? So, blood clots larger than a quarter. Okay, malaki-laki na din. So, bleeding that often lasts longer than 8 days. So, yan. So, may consider natin siyang malakas yung menstruation. If you have any clarification or mga dagdag na information, kindly write it in the comment section. Menstrual cycle. Ayan na nga. So, menstrual cycle length ranges normally from, saan natin sulat dito na lang, 21 to 36 days. Okay? Itong sample natin is hanggang 28. Okay? Pero normally, menstrual cycle is nagra-range sa 21 to 36 days. Typically, menstrual cycle is 28-day cycle. Okay? Cycle or 28-day long. But each woman is different, of course. Kanya-kanya tayo. But 95% of women have a cycle length between 25 to 32 days. Okay? So, may 95% na mga women na merong 25 to 32 days cycle. So, ayan. Also, a woman's menstrual cycle length might be different from month to month. Ngayon, sobrang mahina lang. Next month, malakas naman, di ba? So, your period are still regular if they usually comes within or comes every 24 to 38. Na i-consider pa din siyang regular. Okay? So, this means that the time that the first day of your last period up to the start of your next period is at least 24 days but not more than 38 days. Okay? So, duration of the period ranges from 1 to 8 days. Yan, yung duration, pwede. But most women report a menstrual flow that lasts from 3 to 5 days. Dito ako nabilong sa 3 to 5 days. Okay? Minsan, 2 araw pa lang, pero aabot siya ng 3 na meron na lang konting-konti. Okay? How about you guys? So, class, paano ba yung inyo? Ilan ba yung inyo? Ilang days yung cycle nyo? Okay? Pwede nyo sulat sa sa comment section para magkaalaman, ganon. So, amount of blood also, amount of blood loss, average, ilan kaya? 30 ml. Okay? Or 1 ounce. 1 ounce. Okay? So, 30 ml per menstrual period. Pero nakukonsider pa din as normal range between 20 to 80 ml. Ayan. Ng blood loss. So, actually, menstrual cycle, meron siyang phases. Ayan, isa-isay natin. Sa ibang book, hinati lang siya sa dalawang phase. Menstrual phase and follicular phase is considered as one. Okay? So, ayan, meron namang 4 phases. Yung menstrual phase, follicular phase, tapos yung ovulation phase and luteal phase. Okay? Isa-isayin natin yan later. So, for the menstrual phase, this is the first phase of the menstrual cycle that can last 3 to 8 days. Okay? Pwede siya hanggang 3 to 8. But ang inalagay lang natin dito sa ating sample is up to 5 because commonly 3 to 5. Okay. And dito sa menstrual phase natin, hormone level of estrogen and progesterone, a hormone level of estrogen and progesterone drops here. So for the menstrual phase, this is the first phase of the menstrual cycle and can last 3 to 8 days. But dito sa sample natin, nilagay lang natin hanggang 5 because commonly 3 to 5 days lang yung menstrual phase. Mostly sa mga girls. Okay? Siyempre, sino pa hindi naman pwede sa boys. So, sa mga girls. Joke lang. So, in this phase also, hormonal or the hormone level of estrogen and progesterone drops. Okay? So, yon. So, the period consists of a combination of what? Anong mga lumalabas dito? Anong lumalabas? Ano? Combination of uterus tissues. Okay? What else? Mucus and blood. Okay? The thickened uterine lining, itong red natin, itong red. Okay? Ayan yung ating uterine lining. Is not needed together with the eggs na hindi naman na-fertilize. Kaya, nailalabas siya sa ating menstruation. Okay? In a form of menstrual fluid. Okay? And, sabi nga natin kanina, yung blood loss is 20 to 80 ml considered normal. Pero meron din sa ibang book, 10 to 80 is considered normal. Okay? Blood loss. And, during this phase, the person may experience tenderness in the breast, may experience abdominal cramps. And these cramps are caused by contraction of the uterine and the abdominal muscle to expel the menstrual fluid. Okay? Kadalasan, aminin natin, yung mga mood swing natin, mood changes, di ba? Meron din tayong mga headache, irritability, low back pain, tiredness, kaya. So, those are under menstrual phase. How about follicular phase? Okay, so follicular phase lasts till 13th day of the menstrual cycle. Okay, so this phase typically lasts around 10 to 16 days sa ibang book. 10 to 16. Okay, considered. Kasi nga, sinasabi nga natin na hindi ito para sa lahat. This is individual experience. Sa akin, 5 days lang or 3 days lang. So, it matters na din dito sa follicular phase. Kaya, na-consider na dito sa iba is aabot ng 10 to 16 days. Okay? So, this phase will end when a person ovulates. Okay? Later, i-compute natin kung kailan tayo mag-ovulate. Okay? Kung kailan through counting din. Doon mamaya sa baba. Okay? So, the follicular phase, which some people call the proliferative phase. Okay? Tinatawag din siya as proliferative phase. It is simultaneously with the menstrual phase actually. Kaya sa ibang book, menstrual phase and follicular phase is isang phase lang siya. Kaya yung sinasabi na menstrual cycle is divided into 2 phases. So, ayan. So, during follicular phase, the pituitary gland secretes a hormone that stimulates the egg cells in the ovary to grow. Yan. Kasi nga nagsisimula na siya preparation for ovulation. Okay? So at the start of the cycle, the brain region called the hypothalamus signals the pituitary gland to release follicle stimulating hormone. Okay? Galing yan dito. Okay? Itong follicle stimulating hormone stimulates the ovary to create several small sacs called follicle. Okay? Ayan. Anong naman tong follicle? So, this is a fluid-filled structure in the mammalian ovary. Yes, di ba? Within which an ovum develops before ovulation. Ayan. And this, each contain an immature egg pa muna. Okay? Itong follicles. Kasi madedevelop lang siya pag malapit na yung ovulation. So, the healthiest egg will mature while the rest of the follicles will absorb back into the body. Okay? So, meron lang magmamature na egg. Hindi sila lahat. Okay? So, one of these egg cells begin to mature in a sac-like structure called follicle. Ayan. And it takes 13 days para mag-mature yung follicle. Kaya, na-consider yung follicular phase is up to 13 days. Kasi, aabot sa ganitong days bago ma-mature yung egg. Okay? Actually, there are There are multiple follicles that are maturing in the ovary. Hindi lang naman siya isa. Nagtra-try din yung iba. Okay? Pero mayroon talaga nagiging successful. Okay? And ano na yung magiging tawag natin dun sa mga maturing follicle? Anong tawag? Graphian follicle. Okay? Alala nyo pa? Ayan. So, as the follicle matures, the body releases extra estrogen. Okay? So, ayan. Kung nakikita natin dito sa ating picture, ayan, no, 'di ba? So, habang palapit sa follicular phase, ayan, yung estrogen natin is pataas din. Okay? Together with the progesterone. Ayan. Kasi habang nagmamature yung follicle, yung body din natin ay nagre-release ng extra estrogen, kaya siya tumataas yung level. Okay? And this stimulates the uterine lining to thicken. Ayan, tingnan nyo dito ako, di ba? Ayan, nagtitik na yung follicle, yung lining, uterine lining. Okay? And kasi the thickened lining can provide the necessary nutrients to a fertilized egg. Ayan, nagre-prepare na siya. Buti pa yung uterus natin handa. No? So, ayun. So, estrogen is produced in the follicle. Ano nga ulit sa estrogen? This is a type of hormone made by the body that helps develop and maintain female sex characteristics. Okay? And, pag halimbawa yung follicular phase ends, ito na, pang 14th day na, nagre-release na siya ng mature follicle. Okay? Yung egg na mature na i-release na siya. Yun na ang tawag sa ovulation. Okay? So, while the egg cells matures, its follicle secretes a hormone that stimulates the uterus to develop a lining of blood vessels and soft tissue called endometrium. Okay? And at the end of this phase, the external cervical os dilates. Ito dito. Okay? Yan banda, ha? And slightly to admit sperm. So the cervix becomes softer. So itong part dito, yung cervical os natin, unti-unti na siyang nag-open. So, at the end of this phase, the external cervical os dilates. Okay? Nagda-dilate na siya, nag-open na siya. Kasi, prepared na para mag-admit ng mga sperms. Okay? So, the cervix produces mucus that is thin, slippery, clear, stretchy, copious in quantity, ayan, and designed to aid sperms in passage through the cervix. Yun yung purpose ng ating mga pinoproduce na mucus, okay? The stretching property is called spin barket. Yan. Paano nga ba spell niyan? Ganyan. Spin barket. Tama ba? Correct me if I'm wrong. Okay? So, yon. So, ovulation usually occurs within 24 hours before, during, or after the last day of the slippery discharge. Careful tayo, class. Kasi ovulation, dito sa pang 14th day, ovulation usually occurs within 24 hours before, during, and after the last day of the slippery period or slippery discharge. Kaya dapat alam natin yung mucus natin, kilalanan natin sila. Okay? So, ibig sabihin, it can be 13 or 12 days before or 15 or 16 days after. Lalo naman pag during. Okay? Ayan. Question pala. How long does the sperm cell takes to reach and meet the egg cells? Ilang oras siya? Class, yung pinakamabilis, pinakamaliksi na sperm can reach only in 30 minutes. In 30 minutes, ando na siya. Nagkita na sila ni egg. Okay? So, may mabubuo na yon. Okay? While others may take days. Okay? Matagal din. But, remember, sperm can survive up to 48 to 72 hours. Okay? Anyway, only few hundreds can come closer to the egg because of natural barrier that exists in the woman's body. Okay? Halimbawa, dito sa pang 12 days. Okay? Merong mga sperm nagstay dito at close pa kasi hindi pa naman nag-open yung cervical os. Pero once na nag-open, pwede siyang makapasok. Okay? At pwedeng magkita si sperm at si egg cells. Okay? Alam nyo na kung anong mangyayari. Okay? Kung anong mabubuo. Ayan. So, and a question with the menstrual phase and follicular phase. So, let's go to the next. Ayan. Yung next phase natin. Cycle is, di ba, dito sa uli meron tayong 14th day, yung pinaka-peak. So, the ovulation phase starts when rising estrogen level signals the pituitary gland to release yung sinasabi nating luteinizing hormone. Okay? Okay. So, itong luteinizing hormone natin stimulates the process of the ovary releasing a mature egg. Okay? Ang tawag dito ay ovulation. Ayan, si egg. Pababa na siya. Okay? So, on the 14th day of the cycle, the pituitary gland secretes a hormone that causes the ovary to release the mature egg. Ayan. So, yung pag-release ng egg na yun ay bababa na siya sa ating fallopian tube. Okay? Ayan. Naalala nyo ba nung second year kayo yung tinatawag nating cilia of the fimbriae? Science siya. Okay? So, the released egg cells is swept into the fallopian tube by the cilia of the fimbriae. Okay? Yung mga fimbriae na yan, those are finger-like projection. Diba? Natatandaan nyo pa ba yun? Yung description ng fimbriae are finger-like projections located at the end of the fallopian tube close to the ovaries and cilia. Diba? So, yan. In short, during ovulation, the mature egg travel from the ovary down to the fallopian tube into the uterus na. Okay? So, yan. At any time during the egg's journey and sperm can fertilize it. Lalo na kung may mga nagstay muna dito. Halimbawa, nung 13th day, okay, may pumasok na mga sperm dahil sarado pa naman sa cervical os, andito lang siya. Remember, it can stay 48 to 72 hours. Nakakapag-survive. So, pag nag-open sa cervical os, diretso pasok. Okay, so nagkita na sila. Ayan. So, people who wish to conceive can watch for signs of yung mucus kung thick na siya, di ba? White discharges from the vagina and slight increase in their BBT, yung basal body temperature. Okay? So, kung gustong conceive na, so ayan, watch out tayo dyan. So, a person can measure their basal temperature at home using sensitive thermometer na siguraduhin maganda ang kalagayan. Function typically occurs in the middle of the menstrual cycle. Kaya nga dito siya sa 14th day. Okay? Why sinasabing middle? Kasi kung halimbawa 28-day cycle tayo. And the egg can survive for about 24 hours before it needs to be fertilized. Within 24 hours. So, within 24 hours dito sa egg na bumaba, so dapat magkita na sila ni sperm. Okay? Kasi pag hindi, lumagpas na yung 24 hours, isasama na siya as menstrual fluid. Okay? So, yan. Kasi, yun nga, 24 hours lang siya na kailangan ma-fertilize na siya agad. So, if it does not become fertilized during that time, the egg will dissolve. Ayan. So, next na tayo. Your final phase of the menstrual cycle is called luteal phase. So, this phase begins on the 15th day and last till end of the cycle. Yung luteal phase natin. Di ba kanina kung sa unang slide natin, yung first phase, yung follicular phase, 1st to 14th day. Okay? So, yung luteal phase naman is from 15 to 28 days. Kasi nga, may ibang book na 2 phases lang yung menstrual. Yung menstrual phase, pati follicular phase, isang phase siya. Okay? So, ayan, para hindi tayo malito. Okay? From the follicle that released the ovum becomes the corpus luteum. Ano nga ba ulit sa corpus luteum? Si paring corpus luteum. Ay, sorry na. L-U-T-E. Tama? Tama. Okay. So, yung follicle natin that releases the ovum becomes the corpus luteum. Okay? Itong corpus luteum na to, this is a mass of cells produced, the hormone, anong hormone yan? Progesterone, that makes your uterus a healthy environment for the developing fetus. Okay? Yung corpus luteum na yan releases progesterone which will keep the uterine wall thick, okay, and ready for a fertilized egg to implant. Okay, nakita niyo tong red na part, okay? So, ayan. Okay? So, nagiging thick siya in preparation sa na-fertilized na egg. Okay? Ayan. So, the egg can release during the ovulation phase, stays in the fallopian tube for 24 hours, sabi nga natin kanina, at dapat ma-develop siya. Okay? Dapat mag-meet si sperm at si egg para ma-fertilize. Okay? And a new corpus luteum forms each time you ovulate. Okay? Pag halimbawa, hindi naman nabuntis or what something, so magbe-breaks down ulit siya. Okay? At panibagong corpus luteum na naman. Ayan. So, what else? Itong corpus luteum din pala produce, di ba, estrogen and progesterone. Okay? So, the main function actually ng ating progesterone is to prepare the endometrium or the lining of the uterus for a fertilized egg to implant and grow. Okay? So, if a pregnancy does not occur, itong endometrium din natin is nagsished siya, sheds off, okay? During sa menstrual period. Okay? So, if conception occur, yung progesterone increases to support the pregnancy. Ayan. Actually, yung function lang din naman nun is nag-e-end in the 14 days. Kung hindi, kung walang na-conception, walang na-conceive. Okay? Pag wala, after 14 days, so, nawawala din siya. So, naisasama siya sa magiging menstrual fluid natin. Okay? If the egg becomes fertilized, the body will produce human chorionic gonadotropin. Okay? Ano ito? Ano si human chorionic gonadotropin? Anong function niya ta? It helps keep the uterine lining thick for the fertilized egg to develop into the embryo. Into an embryo. Okay? Embryo. Pag na-develop na, pag nabuo si egg cell and si sperm, ito ang lalabas. Okay? Magiging embryo siya. Ayan. So, yung anong ganap ni endometrium? Anong ganap ni endometrium? Alam niyo ba kung saan si endometrium? Sino si endometrium? Ano si endometrium? Alam niyo na yon. Di sinabi ko lang kanina eh. Ayan. So, endometrium is in the secretory phase. Okay? It increasing vascular and filled with glandular secretions that are ready to support a fertilized ovum. However, sabi ko na naman ulit, if the egg does not become fertilized during ovulation, itong corpus luteum natin ay nagde-deteriorate siya. Okay? Nagde-dissolve siya into the body. And yung estrogen and progesterone ulit natin is bababa. Okay? Kasi magsisimula naman yung menstrual phase. Ayan. Tingnan natin picture. Ito dito, di ba? Mababa kasi magsisimula na naman si menstrual phase. Pag pataas na naman siya, pag magsisimula na follicular ovulation, blah, blah, blah. Okay? Ay, sorry for that term. Ayan. So, pag bumaba na naman yung estrogen and progesterone, that signals the start of the new cycle na naman. Okay. And pala, ito bago ko makalimutan, during the luteal phase, a person may experience symptoms of premenstrual syndrome or tinatawag nating PMS. Okay? This includes what? Okay, merong mood change, headache, di ba? Pain, tenderness, swelling of the breast, okay? Change in sex drive, weight gain, difficulty sleeping, at siguradong nararanasan nyo to, food cravings, di ba? Ayan. Parang gusto kong kumain ng isaw, gusto kong kumain ng mangga. Kala mo buntis, hindi pala. Nag-craving ka lang kasi magsisimula na naman yung cycle mo, di ba? And the hormones that causes the uterus to retain its endometrium gets used up by the end of the menstrual cycle. And this causes the menstrual phase of the next cycle to begin na naman. Ayan. So, we are done, I think, with the menstrual cycle. And a question, if you have any question, just write it in the comment section, then I will answer it later. And if you have additional information about the menstrual cycle na hindi ko na-tackle, padagdag na din for the information of everybody at para sa akin din. Ayan. So, go na tayo sa ating, ayan, common deviations from normal in the menstrual cycle. Meron tayong amenorrhea, okay? So, amenorrhea, it's the absence of menstrual period. At kadalasang cause dito ay pregnancy, okay? So, hindi na ako dinatnan. Ayan, so it's a cause ng amenorrhea, pregnancy. And meron tayong primary amenorrhea. It's the failure onset of menstruation and due to chromosomal defect. Chromosomal defect. Ayan. So, ayun na nga. Ayan, ubusin na lang natin to. Ayan. So, ayun na nga. So, primary amenorrhea, there's a failure of the onset of the menstruation. And dito sa failure of the onset of the menstruation, halimbawa, dito muna tayo ha. Okay, yan. So, by the age of 14, in the absence of the, anong tawag nun? Yung sinasabi ko kanina? My God, nakalimutan ko, loading ata ako. Sex characteristics, secondary sex characteristics. Diba? Yung breast development, yung hair, pubic hair, ganyan. So, nagkakaroon ng primary amenorrhea, it's because of the failure of the onset of the menstruation. Onset ng menstruation or menarche by the age of 14. Pag wala pa din absence ng secondary sexual characteristics. At by the age of 16 naman, in the presence of secondary sex characteristics. Okay? Ayan. And this might be due to hormonal or, not hormonal, might be due to chromosomal defect. Okay? Kaya nagkakaroon ng primary amenorrhea. Okay? Ano naman itong mga chromosomal defect? Like yung congenital agenesis of the ovaries, okay? Or uterus, okay? Or yung halimbawa, yung hindi na, non-functional. Okay? Chromosomal defect, lagay na lang natin para din natin makalimutan. Non-functional. Okay? So, this will not produce ova, okay? Or the hormones necessary to initiate puberty. So, wala. So, that is considered in the chromosomal defect. Okay? Cyan. So, secondary amenorrhea naman, interrupts of menses prior to the age 40. Okay? In the previously menstruating woman. Pag okay naman siya dati, tapos bigla pag 40 na interrupt yung menstruation niya. So that is considered as secondary amenorrhea na hindi naman siya buntis. Diba? Or absence of menses for 6 months na hindi naman siya buntis. Ayan. Or kung halimbawa, absence of menses for 6 months or the equivalent of 3 cycles in a woman who does not menstruate every month. Ayan, 'di ba? And menarche. Okay, menarche usually requires a minimum height of 5 feet. Or ilan ba cm ang 5 feet? 152 cm. Okay? And a minimum weight of 47.5. Okay? At yung fat level niya. Okay? So, ayan. At kung yung mga female with body fat level less than 16%, seldom menstruate lang yon. Okay? And, last natin, menarche delay is common in girls who are competitive athletes. Okay? Who have eating disorders such as anorexia nervosa or who participates in activities in which extreme thickness is valued. Okay? Halimbawa yung mga nag-gymnast, yung mga gymnastics, diba? Yung mga nagbabale, yan. Might lead to the development of osteoporosis if estrogen level are consistently low for a period or a prolonged period of time. Ayan. So, next natin is anovulatory cycle. So, anovulatory cycle, in here, Graafian follicle matures and estrogen is produced but no ovulation. Diba? Na-mature naman yung follicle. Tapos yung estrogen naman is nag-produce pero walang ovulation. Anong tawag nan? Anovulatory cycle. Okay? Actually, itong anovulatory cycle, common in the early years following menarche. Diba? And the years immediately preceding menopause. Nagkakaroon itong anovulatory cycle. Okay? So, dito din sa Graafian follicle matures pero walang ovulation. yung corpus luteum dito, anong nangyayari sa corpus luteum? Does not form. Okay? At yung progesterone is not available. Yes, merong estrogen pero progesterone is not available. Okay? Progesterone not available. Corpus luteum does not develop kasi nga ang ano lang dito is nagpo-produce lang yung estrogen. Progesterone and corpus luteum is not available or did not form. So walang thickness dito na nangyayari, okay, sa may endometrium. And what else? Yung progesterone dito induce signal to start and stop the menstrual flow is absent. Wala din. Okay? So, this might result in light, irregular menses, and difficult in conceiving. Ayan. Or might result in frequent, prolonged, malakas na menstruation flow. Okay? Sayang. Letter C, inadequate short luteal phase. So in here, the corpus luteum stops producing hormones prematurely or produces inadequate level of estrogen and progesterone. Okay? And it can lead to infertility and what else? Can cause early pregnancy loss. Okay? So in here, nagkakaroon ng early pregnancy loss when progesterone level are too low. Okay? To support the pregnancy until the placenta formation is complete. Kaya, naiko-consider siya, isa siya, itong inadequate luteal phase or short luteal phase, considered as the common deviation. So, next na tayo, certain events and condition can affect a person's menstrual cycle. So, there are possible issues or complications that people experience of the menstrual cycle, okay? And differences, of course, can include the length of the cycle, yung kanyang, lakas ng menstruation, severity of the premenstrual symptoms, ayan, those are the possible issues, okay? And the person's menstrual cycle can also change at different periods during their life, okay? Such as before menopause, ganyan. And sometimes, it can be difficult to identify issues with the menstrual cycle. So tayo, we need to track our periods, okay? By recording kung kailan nag-start at kung kailan nag-stop. Okay? And this will help improve the awareness, diba, of any problem or changes ng ating menstrual cycle. Okay? And pag nag-record din tayo, ilagay din natin kung malakas siya or hindi gaano, ilang pads ang nagagamit, ganyan. Okay? So, dito na sa mga events or conditions that can affect a person's menstrual cycle is pregnancy, eating disorder, use of hormonal birth control, uterine fibroids, and ayan, yung mga merong polycystic ovary syndrome. Okay? So, yon. So, with this, kailangan na talaga nating magpa-consult sa ating OB-GYN. Okay? So, yan. So, I think I am done with the menstruation. Ayan na nga, oo. I am done. Next na natin is the Fertility Awareness-Based Method, okay? So, yung ating calendar days method, standard days method, billing ovulation method, symptothermal method, and 2-day method. Ayan. So, tayo, nurses, should explain the different types of fertility awareness method and provide to the patient with instruction and how to use it. Okay? And because this is highly individualized, it doesn't mean that this method is effective to you and same with your friend. Baka sa iyo, oo, pero sa iba hindi. Okay? It still depends on the cycle and on monthly basis then. There are still gynecologic problem that happens in the way that we don't even realize that it will occur, diba? Also, class, you really need to explain the menstrual cycle and let the patient understand the process, right? In order for this method to be effective. Ayan. So, yung effectivity pala netong fertility awareness method is something around 80% according to some research. Okay? With the mechanism of action of these methods we need to identify the fertile days in a woman's cycle, so sexual intercourse can be avoided during those days. Ayan. So, start na tayo. Yan, number 1. Calendar days method. This is based on the menstrual cycle or for 6 months to 1 year. Kaya nga dapat nire-record natin. Okay? So, calendar days method, we need to use we need to use a calendar, of course. And kailangan nating i-track yung cycle natin. Huwag nating kalilimutan. 6 months to 1 year. So, in here, we can make notes for the shortest and the longest menstrual cycle. Okay, sample natin. Halimbawa sa January, start ng menstruation is 2. And, ilan na to? 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26. Okay, about sabihin na natin dito tayo sa 27 ulit nagkaroon ng menstruation. Okay? Ayan. So, tapos, so ilan days ito? 26. Diba binilang natin kanina. Tapos sa February, halimbawa 23. So, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28. 28. Yan. And sa, tama ba ang pagbilang natin? Okay, sa March naman. Ba sa March, 26. So, ilang araw yung 26? 2, 4. 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30, 32. O may 32 days tayo dito. April, halimbawa 20. So, 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26. So, 26 lang din. Tapos, nung May, halimbawa 15. 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26. Nakakadami na sa 26. Tapos ngayong June, halimbawa 15 ulit. 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30, 32. Ayan. So, ilan ang pinaka-short natin is 26. Tama, 26. Ang pinaka-longest natin is 32. Okay. Yung sa shortest, we need to subtract this into 18 days. Okay. So, ilan plus 8? 16. So, ayan. So, meron tayong 8. The number that you get are the start and the end of the days you are fertile dito sa ating makukuha. Okay? So, ayun. Sa 32 naman, minus natin is 11. Kasi ito yung pinaka-longest. So, 1 and 21. Okay? So, dito, yung cycle natin, yung short cycle is 26 days and your longest cycle is 32 days. So, yung fertile days natin are from day 8 hanggang 21. Okay? And you should avoid sexual intercourse on those days. So, halimbawa, next na natin dito sa July natin. Sa ilan daw? 8 days. Ito nag-start 2, 4, 6, 8. So, from here, 8, 10, 12, 14, 16, 18, 20, 22. Ay, tama, 22. So, dito July 5. So, July 5. So, You should avoid sexual intercourse from June 22, pasensya muna, hanggang July 5. Okay? Kasi yon yung fertile day natin. Yan. Gets na? Huwag kang lilimutan. Highest number, longest cycle, longest day, minus 11. Shortest day, subtract nyo ng 18. Ayan. Okay? So, kung hindi pa din nakuha, you can write sa comment section at i-compute natin. Okay? So, ayan. So, next na natin is standard days method. So, this is based on expected days of ovulation in the cycle. Okay. So, yung standard days method natin, we need to count the first day of your period as the day 1 and avoid sexual intercourse between ilan dito? Days 8 to 19. Okay? So, yun yung standard na yung standard days method. So, this is from 8 to 19. Day 8 to 19th day, hindi ka pwede. Okay, halimbawa, ano daw natin dito? Halimbawa, yung first day ng ng menstruation, o halimbawa 2 yung first day. So, ito yung first day. You will count. Okay? 1, 2, 3, 4, 5, 6, 7, 8. So, here, 8. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, hanggang 20. So, dito, wala muna. Okay? So, ayan. Yan yung tinatawag nating standard days from day 8 to 19. Okay? So, ayan. So, okay, question sa ating standard days method. Do not forget day 8 to day 19 ng menstruation. Okay? And you will count the first day of your period as day 1. Okay? So, from day 1 hanggang day 7, you are free. Okay? But day 8 to 19, no. Okay? So, ayun. So, this is good only for those individuals who have a regular menstrual period. Okay? And use this together with the other method. Hindi lang standard day cycle. Pwede mo ding isama si billing ovulation method. Okay? So, as I discussed a while ago in the follicular phase of menstrual cycle, yung cervix natin produces mucus that is thin, clear, slippery, ano pa sabi ko kanina? Stretchy, copious in quantity, and ano pa? Those type ng mucus designed to aid sperm in passage through the cervix. Diba? And typically last around 10 to 16 days. But tandaan, yung mga days natin na sinasabi, mula pa kanina, depende sa cycle nyo. Okay? So, this phase will end when the person ovulates. Okay? So, ayan. Day 1 to 6, dry. 7 to 9, creamy. Tapos ito, fertile ka na dito. Okay? Pag yung mucus is wet and clear and ganyan, egg white. So, ayun na nga. So, pag halimbawa, stretchy, ganyan, yung mucus, avoid sexual intercourse. Kailan? 3 days? 3 days before and 2 to 3 days after the cervical secretions na ganyan. 2 to 3 days. 3 days. Okay? Ano ulit yung sabi ko? During Mamaya. Sige, simulan natin ulit. Billing ovulatory method starts sa first day after your period ends. Kaya halimbawa, andito yung menstruation mo. Menstruation. Tapos, pwede ka na magsimula mag-track ng period mo pag nag-stop na yung menstruation. Okay? So, track the amount and texture of your cervical mucus. And the secretions start off as sticky with a cloudy color pa lang. Di ba kasi katatapos pa lang ng menstruation. And during fertile days, the secretions will change to clear, okay, slippery, paulit-ulit kong sinasabi, di ba, copious in amount, and stretchy. Ayan, di ba? And avoid sexual intercourse 3 days before and 2 to 3 days after this type of cervical secretions. Okay? Para sigurado. Kasi, kung halimbawa, dito dito hindi ka pa fertile. Pero yung sperm is naandun lang nag-aabang hanggang sa mag-open yung cervical os. Edi, pasok pa din siya. Okay? Kasi nga, 3 days before. So, 10 days. So, 9, 8, 7. So, hindi ito safe. Okay? So, yan. So, pag natapos na din, halimbawa, asan yung picture dito tayo para mas maliwanag. Dry. Tapos, ayan, dry. Creamy. Dito magsisimula na ng wet and clear. So, fertile na dito. Okay? Ayan, hanggang dito. So, pabalik tayo magbilang. So, from here, na nag-start 3 days before and 2 to 3 days after. Hindi ka pa din safe dyan. Okay? Kasi pwede pa din maging embryo si egg at si sperm. Okay? So, ayan. So, ay na question. Next na tayo. Ayan. Thermal regulation naman tayo. Thermal regulation, symptothermal methods. So, this is based on cervical mucus and body temperature. So, magkasama sila. Hindi lang is the temperature lang. Okay? Observe din dito yung cervical mucus. Okay? Because this method is used in the combination of ovulation method, yung mucus, di ba? And you need to take the basal body temperature every morning at the same time before getting out of bed. Kasi wala ka pang ganong ginagawa. Hindi ka pa naglakad sa init ng araw. Okay? And you need to record your readings on a chart. Ayan, ganito yung chart natin. Ito ditong 1, 2, 3, 4, 5. Ito yung halimbawa, ito yung days. Okay? Days of menstruation. Halimbawa, day 1, day 2, day 3 ng menstruation mo. So, masasabi natin na bawal or no sexual intercourse around the time of ovulation kasi nagkakaroon ng increase ng temperature ng around 0.4 Fahrenheit or 0.20 Celsius. Okay? Nag-i-increase yung basal body temperature natin. And this increase will remain elevated until the start of the next menstrual cycle. Halimbawa, dito na tayo. Day 1. Okay? Tapos day 2. Tapos day 3. Day 4. Pa din. Tapos, day 5. Tapos, balik ulit. Day 6. Pero dito, 7, 8, 8. Tas sa day 10, pataas na siya. Okay? Hanggang ganyan. Pero siguraduhin mo, hindi ito, yung naglalagnat. Ayan. Tapos, i-trace natin. Ayan. Tapos, itong increase niya, hindi naman kailangan talagang 37, okay? Anyway, 37 is still considered normal, di ba? Pwede namang 36.8 lang, pero mataas, dire-diretso na siya hanggang sa mag-start ulit yung period natin. Okay? So, dun natin makikita na fertile day natin is kung mataas yung, hindi mataas na abnormal ha, tumaas lang yung temperature from usual at na-maintain yung elevation niya. Okay? So, yun. Any question? So, ayan. So, siguro, daw dito? Consider gagawing maayos, gumagana yung temperature. Temperature thermometer. Okay? At observe din natin yung mga secretions. Ayan. So, next natin is 2-day method. So, this is based on cervical mucus pa din. Okay? If it is present or absent. Okay? So, halimbawa, this 2-day method, you notice any type of the cervical secretions today? Halimbawa, today, may na-notice ba akong cervical secretions ngayong araw? Yes. So, pag yes, you should consider yourself fertile today and avoid sexual intercourse. Pag sinabi namang no, you are not likely not fertile at this time. Not fertile. That is today. How about yesterday? Did you notice any type of cervical secretions yesterday? Yes. Pag yes, I can be pregnant kasi fertile ako today. And avoid sexual intercourse. But if the answer is no, so pregnancy will not occur kasi not fertile. Okay? Yan yung 2 days method natin or 2-day method. Today and yesterday. Yun yung i-observe natin. Pag may secretions ka na slippery, ganyan-ganyan, yung description natin ng ano nga to? Ng ating mucus, 'di ba? Pag wet, pag clear, pag egg white, ganyan. Tapos stretchy siya. Pag yes, prepare mo na lang yung habang buhay mong responsibilidad. Okay? So, ayan. So, any question? I think we're done with the fertility awareness method. And for the advantage, syempre meron din tayong advantage and disadvantages. So, advantage of use, no exogenous hormones involved, and expensive method, reversible. Okay, kasi bibili ka lang dito ng calendar at ng magandang thermometer. Diba? Reversible, can use same method to identify fertile days to increase chance of pregnancy. Pwede nating i-reverse. Disadvantage of use, no protection against STIs, and during potential fertile days, which may be 1/3 of the woman's cycle is nakukonsider nating fertile days. So, woman not engaged in the sexual intercourse. Okay? So, ayun. So, for our clients, we need to let them think which to use. Okay? So, let them know the advantage and the disadvantage of the fertility awareness-based method. And if these are not appropriate for them, may refer the patient to a rural health unit and talk to the family planning consultant or to the doctor for them to be guided what to use and what is most good for them. Okay? Kasi hindi pala siya pwede sa calendar-based, ganyan. So, ayun. So that they will be guided. So, I think I may end the discussion by telling that let's be responsible in discussing this method to our clients, right? Because this is highly individualized and not intended to all. Okay? Ayan, thank you. Thank you for being with me. I will end the discussion with a simple note saying, be informed, be knowledgeable. And again, if you find it informative, do like, share, and subscribe to my class for you to be updated. And you may comment your suggestion, reaction, clarification, and if you want to have a topic that you want to talk to, ayan, isulat lang. And goodbye for now. Be safe all the time. God bless us all. Thank you.